Hello, and welcome to Better Health. I'm Dr. Bobby Stowe, and this show is about you, the audience, the patient. In the next 30 minutes, we will explore, answer, and hopefully intrigue you to think about alternative methods to help you explain and treat medical conditions and to help you achieve and maintain health. In our last show, we looked at how chronic inflammation can have a devastating effect on your body and the laboratory tests you can ask for in order to detect whether or not inflammation is present in your body. I hope you remember that chronic inflammation is a condition that you will probably not be aware of, and that is why lab tests are so very important. Because chronic inflammation is a disease and can cause so many systemic conditions, knowledge of this situation can provide extremely useful information to start the process of determining the cause and finding the solution and possible cure before a condition can manifest into a disease. Please understand that there are many reasons for chronic inflammation, but the critical issue is knowing that you are affected by an inflammatory process. It is vital that this chronic inflammation be reduced so that it does not result in a life-threatening illness. Chronic inflammation can slowly but surely rob the body of their health and shorten a happy and productive life. Speaking of health, let's define what I believe health really is. Health is not merely the absence of disease, but rather a homeostatic balance of the systems and processes of the body. It is the harmony of the 12 systems of the body that allow it to function in a healthy manner and hopefully prevent disease. Again, this show has been designed with you in mind for information that you can use to be better informed about achieving and maintaining your health. Many times there are alternative methods available for a given condition, and it is my desire to inform you about these treatments and therapies, as well as strive and seek better health.
We don't just do things bigger and better, but smarter and faster. We are pace setters, trend makers, caretakers. A community serving a greater community. Turning homegrown talent into a hometown workforce to be reckoned with. At HCC, we don't just keep Houston relevant, we prepare our students for success. HCC, smart decision.
It's exciting and bold, yet classy and comfortable. It's the Tom Felicia Home Collection that puts the finishing touches to your perfect living environment. James Craig Furnishings in Houston offers the Tom Felicia Home Collection, along with other fashion-forward home furnishings, fit for every lifestyle. They offer the designs you want and the service you deserve. Visit James Craig Furnishings.
I am making my emergency kit. I want to be prepared just in case.
Oh, my friend Mia made a kit with her family. Everyone help. They packed flashlights and batteries, water, food, a radio, and put it where they could find it rapidamente, quickly.
I guess I should take my canoe out of there, huh?
Look, brother.
Help your family get ready for an emergency. Learn more at ready.gov/sesame.
Explore new worlds. Read. Visit literacy.gov.
Welcome back. Today in the news, we learned that on January 13th of this year, the Food and Drug Administration, the FDA, announced that it's asking all drug makers to limit the amount of acetaminophen in their prescription combination pain relievers to no more than 325 milligrams per tablet to reduce the overdoses and the severe liver injury that it's causing. The FDA is also requiring pharmaceutical companies to update the labels, what is called a box warning, on the risk of severe liver injury if too much acetaminophen is taken or it is consumed with alcohol. For those of you who may not be familiar with acetaminophen, it is a drug used as a pain reliever and to reduce fever, and it is found in many common products like Anacin, Tylenol, NyQuil, Dynatap, Excedrin, and acetaminophen, just to name a few. In fact, if I were to hold this printout of the acetaminophen from the NIH or the Institute of Health, its website lists 6 pages of brand names or combination names of all the products that contain acetaminophen. Because of this new FDA warning and the fact that too much acetaminophen can cause liver failure and death, I would strongly suggest that everyone in the viewing audience look at the NIH website and see if any drugs you are taking are on this list. If you are taking one of these drugs, you might want to consider contacting your medical doctor and find out what he or she would recommend. Remember, this is a new warning from the FDA, and I don't believe it should be taken lightly. For our second news story, I would like to ask all of you a question. I would like to ask you, what kills more people in America besides guns or alcohol? What would y'all guess? Well, according to the Center for Disease Control and Prevention, the CDC, the answer is drugs. But I'm not talking about illegal drugs, but rather drugs obtained legally from a doctor, a hospital, or over the counter for some sort of medical condition. According to this report, published in the January 14th CDC's Morbidity and Mortality Weekly Report in 2007, 38,371 drug-induced deaths occurred. These drug-induced deaths include and are attributable to acute poisoning by drug overdoses and to deaths from medical conditions resulting from chronic drug use. The report goes on to say that prescription drugs, especially opioid and painkillers and psychotherapeutic drugs, were prescribed more widely by physicians during this reporting period and attributed to what I believe is this very alarming number of deaths. As I have stated previously in other shows of Better Health, I believe there are a better way to treat the body for a variety of ailments than drugs. I do understand and realize that prescription drugs are needed for a variety of conditions or diseases. But what I would ask again from each of you watching this program is to look at yourself or your family or friends and be aware of the possibility that they could be overusing these prescription drugs. If you or someone you care about might be in this situation, please notify the doctor for proper intervention. Remember, 38,371 people died in 2007 as a result of drug overdoses. Please don't let you or a family member or a friend become a statistic like this in 2011. We're going to take another short break, but when we return, I'm going to educate you on the extreme importance of vitamin D and why the sun is really your friend and not your enemy. So stay tuned, and after this short break, I believe you will learn a great deal about better health.
We are united by more than just geography. We are a community within a community, essential to the common good. locally driven, and globally demanded. Proud of our diversity and focused on the future. HCC is the opportunity that leads to more opportunities. HCC. Smart decision.
I'm Jeremy Call, and I made suction tires. Wait, what? Wait. I used a rivet gun to connect the suction cups, and then I just connected it to the tire. I got the idea from an octopus because of the suction cups, and I don't know.
Anything's possible. Keep thinking. Get started on your invention at inventnow.org.
Inactive activities on a glorious day. Huh? Let's get out there and play! Sweet.
There are lots of great play ideas online.
The forest is special, magical, and very precious. One careless act caused by people, and its beauty could be gone for a lifetime. Protect our friends in the forest.
We'll all pitch in.
Only you can prevent wildfires.
To find out more, log on to SmokeyBear.com.
Welcome back to Better Health. I'm Dr. Stowe. Okay, so how many of you have heard or been told to stay out of the sun because too much sun exposure can lead to skin cancer? I'm sure that many of you have heard this, and based on the evidence that I'm about to present, it would appear that far too many people have followed these instructions. I say this because avoiding the sun, Americans and many other people around the world who follow this advice are now a major part of an epidemic of vitamin D deficiency and the major diseases that this deficiency is causing. I first want to state that I agree with the advice that excessive sun exposure can certainly lead to skin cancer, but I would suggest in only a small percentage of the U.S. population. And why would I say this? Well, let me put forth a theory. For as long as we have been on this earth, humans have been in the sun. For centuries, our ancestors were hunters and gatherers. Then they worked the fields and the farm. And it's only in the very, very recent time, say within the last 70 or 80 years, that we have moved from the outside into buildings with air conditioning and artificial lights. What I would propose is that if you have a genetic predisposition to acquiring cancer from the sun, then certainly you should avoid the sun or at least limit the exposure. However, with that said, thousands of scientific research papers on vitamin D demonstrate how extremely vital this nutrient is to our body and how you should think about the majority of vitamin D and how you get it. How do you get it? From the sun. So what is vitamin D and why is it so important for all of us humans to have this nutrient? Well, first, let's look at some interesting facts about vitamin D. Vitamin D is not only a vitamin, but it is also a hormone. It is necessary for calcium to be absorbed. It is necessary for energy production. It protects against muscle weakness. It plays a role in the strength of our bones and cartilage, as well as insulin production. It is involved in the regulation of our heartbeat. And these are just some of the important facts that you should know. Another thing is that hydrochloric acid, also known as stomach acid, has to be present in the stomach to break down vitamin D that has been ingested. So for many people, especially older Americans with stomach issues, or for those who are taking antacids, you may not be getting the vitamin D you thought you were from your diet. Also, cholesterol is a precursor to make vitamin D. In other words, you have to have cholesterol to make vitamin D that you obtain from the sun. However, there's a problem with this in that many Americans have been told by their medical doctors to lower their cholesterol with the use of a statin drug. At the same time, they're not being told to start taking a vitamin D supplement to offset the loss of vitamin D because there isn't enough cholesterol to make vitamin D. So, for many people, getting the vitamin D from the sun due to cancer warnings, some do not get enough due to the antacids, and then others don't get enough because of the drugs they take to lower their cholesterol. Any wonder why we have a vitamin D deficiency in this country? It is also important to note that individuals with liver and skin disorders can have a vitamin D deficiency because this is where most vitamin D is stored. However, sufficient vitamin D can reduce inflammation, it can reduce autoimmune reactions in multiple sclerosis, arthritis, psoriasis, and inflammatory bowel disease. It can increase performance in athletes and reduce injuries, and it supports your adrenal glands and can reduce the risk of many cancers. So now that I've told you a little bit about vitamin D, let me give you a couple of other lesser known but extremely relevant facts. First, just last year, 2010, there were over 1,500 articles and research papers on the effects of vitamin D deficiency. I'm telling you this to point out that vitamin D is a major concern to all Americans. The deficiency is a major concern to all Americans, and for you as a patient, and you need to be acutely aware of the effects it can have on your body. One of these research papers was presented by the American Heart Association in 2009 with the title, Vitamin D, a Potential Role in Cardiovascular Disease Prevention. Quoting now from the paper, we concluded that even a moderate deficiency of vitamin D was associated with developing coronary arterial disease, heart failure, stroke, and even death. Other studies have stated high doses of vitamin D supplement may reduce the risk of falling among older people. And in another study, vitamin D deficiency raises heart failure mortality risk. Another, vitamin D deficiency has been linked to depression in older Americans. And in a study published in the Journal of Cancer Epidemiology, Biomarkers and Prevention, researchers found that people with the highest blood levels of vitamin D had a 55% lower risk of dying from cancer than those with the lowest levels. I could literally do this entire show just reading the research that has come about on vitamin D, but by now I think you've gotten the message. Vitamin D is a very, very important nutrient. Here's another major point of interest, especially if you've seen my presentations on supplementation. This comes from a research study that was presented at the meeting of the Joint Consortium of Multiple Sclerosis and the Centers of American Committee on the Treatment and Research in Multiple Sclerosis. This study looked at the contents of over 10 over-the-counter vitamin D products, and in all 10, 100%, each one of them failed to deliver the dose that was stated on the label. This actual content, or the actual content, ranged from 1% to 82% of the advertised label on the bottle. And in all 10 brands, they only achieved approximately 33% of what was stated on the label. I hope it goes without saying that this is a very strong point of contention with me because I believe that most OTC or over-the-counter supplements that Americans purchase are of extremely inferior quality. So at the end of this program, if you decide that vitamin D will be derived from a supplement form, please find a qualified healthcare professional with a proven quality product to augment the needs, your needs for vitamin D. So again, I hope by now you realize how important vitamin D and your immediate need to either obtain greater sun exposure or find a qualified supplement, quality supplement. But how do you know how much vitamin D you need? Or is there a possibility that you have too much vitamin D currently in your body? Well, of course, the answer is through a blood test. And the best test is the one that measures your body's store of vitamin D. You would simply ask your doctor to order a vitamin D blood test or a 25-OHD. This is the stored form of vitamin D and the best marker for vitamin D status because it tells us how much we are getting through consumption or through skin exposure. Another important point. If you're going to take a supplement of vitamin D, you need to make sure that it also contains vitamin K. Probably a lot of you haven't heard of vitamin K, but it's a vital nutrient that's needed in the transport of calcium and vitamin D into bones. Without K, too much calcium or vitamin D can be left in the blood, and that increases the risk of calcium deposits in arteries and soft tissue. Okay, so now the tests come back and I'm deficient in vitamin D. So how much can I safely take, and should I follow the RDA recommendation, which is about 200 to 600 IUs per day? But that level seems to be quite inadequate in light of recent research. What most knowledgeable professionals believe is that you want your blood levels to be in the 54 to 90 nanograms per milliliter for optimum levels to reduce your chance of acquiring any of these conditions I've mentioned earlier. So your supplementation will depend on your current blood level of vitamin D, but doses from 4,000 to 5,000 units and higher have been reported not only to be safe, but effective. There's one more segment in our program, and it's called Ask the Doctor. This is where you, the viewing audience, can ask me questions. So let's take one last break, and we'll be right back.
The future of higher education and a skilled workforce for our great city starts here. Welcome to Houston Community College. We are opportunity. We are essential. We are hope. We are a gateway to education, to jobs, and to the future. There has never been a more important time for community colleges in our country's history than now. At HCC, we are redefining what a community college can be for our students and for our community. Our reach is extraordinary. Our outcomes are revolutionizing how students approach their education and how employers meet their needs for a highly trained and skilled workforce. HCC is recognized across the state, the U.S., and even internationally for both what we deliver and how we deliver it. With the future workforce requiring more post-secondary education, we are well positioned to help both students and their future employers succeed. And we're making it easier for our students. With campuses across the community, creative scheduling, and innovative payment options, education has never been this accessible. At HCC, we are locally driven and globally demanded. We turn homegrown talent into a hometown workforce. We are proud of our diversity and focused on the future. We are a community within a community, essential to the common good. So when you think about what's next, when you think about what can be, think HCC. We are the opportunity that leads to more opportunities. HCC. Smart decision.
So, Malcolm, you do know that energy savers last 6 times longer than ordinary light bulbs.
This isn't my room. It's Baron Davis's.
Baron Davis, the basketball player? This is his room?
Yep.
Interesting, because we have Baron Davis right here. Baron, do you live here?
No.
I don't mean that, Baron Davis.
Millions of kids are using their energy wisely. What's your excuse?
Welcome back to Better Health. I'm Dr. Stowe. In our last program, I talked about inflammation and all the possible health issues that can arise from having this hidden chronic disease inside of your body. So a viewer writes, I called my doctor about having the tests ordered that you mentioned on the program, but his office said it wasn't necessary to have these tests. So now what am I supposed to do? Well, what I'm about to tell you is not common knowledge, but in the state of Texas, anyone can order their own blood lab work. All you have to do is go into a lab that's close to your home or in your neighborhood and order your own test. Now, I understand that I don't know what your insurance is going to do. I don't know how it's going to be paid for. You may have to pay for it yourself out of your own pocket. But you certainly have the right in the state of Texas to order your own labs and determine what is going on inside of your own body. Well, this ends our episode of Better Health. I hope you've enjoyed the show. It is my desire to help educate individuals about a variety of conditions and treatment options that exist outside of the conventional medicine. I should also state that I am in no way making any type of diagnosis for any condition. All of the comments on the show are for informational purposes only. Any condition that you have or you think you might have should be discussed with a qualified healthcare professional. Again, I encourage you to send me your questions, anything you might have regarding today's topic or any other health-related topic. Just send them to me at hcctv@hccs.edu. And as time permits, I'll answer your questions on air. Until our next show, take care, enjoy life, and live healthy.